If you have been told that your pregnancy is very high risk, if your previous losses have replaced excitement with fear, I want you to listen to this story carefully. This is not a story about ignoring medical science and risks. This is about understanding physiology and how outcomes can change when we work at the root cause level. At TruHealing, we don't promise miracles. We restore safety, regulation, and biological capacity. Now, one of my clients, Surekha, she came to me with what we medically called bad obstetric history with recurrent pregnancy loss, BOH with RPL. I mean, she had suffered multiple pregnancy losses, and in one of the previous pregnancy, she developed severe hypertension, which progressed to severe pre-eclampsia, and tragically, it resulted in a mid-trimester stillbirth. Now, I want to say this clearly, this was not bad luck, this was not failure of her body, this was a physiological breakdown. Now, pre-eclampsia is often misunderstood as just blood pressure, but it is not. Pre-eclampsia is a placental vascular disorder which involves abnormal implantation of placenta and inflammation and oxidative stress, leading to reduced oxygen and nutrient delivery to the baby. And when the placental blood flow is compromised, fetal growth can slow down or even stop. And in severe cases, intrauterine fetal demise can occur. And this is exactly what happened to Surekha. So the loss she experienced was devastating, but it was medically explainable. Now, fast forward when Surekha conceived again, next pregnancy. Now this one turned out to be a monochorionic diamniotic twin pregnancy. Yeah, so after the loss she conceived again, but this time with monochorionic pregnancy. And this is one of the highest risk twin pregnancies in obstetrics. So what happens in monochorionic pregnancy, that both the babies share a single placenta and blood vessels are interconnected. So the blood flow can become unequal and unstable. Now this creates risks such as twin-to-twin transfusion syndrome, growth restriction in selective babies, abnormal Doppler blood flow, and even sudden fetal compromise. And also it significantly increases the risk of pre-eclampsia, preterm birth, and stillbirth, all of which Surekha already had a history of. And that's why Surekha was given a very, very poor prognosis by multiple doctors, and understandably so. And slowly she started losing trust in her body once again, and she was not even sure whether she wanted to continue this pregnancy. Then one of her friends referred her to me for a second opinion, and now this friend already had a twin pregnancy delivery with me many, many years ago, and she had a very great outcome, but monochorionic twins is a different story altogether. When Surekha came to me, she was already pregnant around 2.5 months, and I told her something central to the TruHealing philosophy, that risk is real, but risk is not destiny. Physiology can be supported. Conditions like pre-eclampsia are multifactorial, and while some things are out of our control, but there are so many more modifiable factors which give power in our hands. And these factors involve metabolic and insulin regulation, inflammatory load, nervous system stress, and unresolved trauma from previous pregnancies. All these factors can be modifiable. And once we did the detailed blood work and learnt about the root causes, and I told her these things can be balanced if she is willing to do the work, and Surekha committed fully. We worked holistically within my TruHealing pregnancy program, and alongside medical care, we also worked on her mindset, emotions, and nervous system. Our focus was calming the nervous system, reducing chronic sympathetic overdrive, supporting placental blood flow, stabilizing blood pressure, reducing inflammation, and releasing stored trauma in her body from previous pregnancies. Now, this is not alternative medicines, dear ones. This is neurobiology and neurophysiology. And when the mother's body feels safe, the placenta functions better. Now, there came a turning point in the story because as Surekha, when she came to me, she was already 2.5 months pregnant after conception. The complications between the twins had already started. And by the 4th month, the Doppler flows worsened. and one twin stopped growing. The vascular imbalance became dangerous and a selective reduction was medically required to save the other baby. Now this was not failure, this was life-preserving care. And I told Surekha that now we will give this other baby the best possible internal environment to thrive. And the rest of the pregnancy progressed beautifully. No recurrence of severe hypertension. In fact, her blood pressure remained low throughout pregnancy. No swelling, no gestational diabetes, no placental crisis. The baby was delivered at 36 plus 4 weeks, an excellent outcome for a high-risk monochorionic pregnancy. The baby required no NICU intervention except observation in view of the high-risk history, and equally important, the postpartum period was stable for Surekha. Good milk supply, emotional regulation.
Yeah, hi, myself Surekha. So I would like to share my experience with the TruHealing pregnancy program journey. First, let me tell you my pregnancy history with you. And actually, in the year 2023, I got pregnant for the first time. That time during 8 month pregnancy, I lost my baby due to high blood pressure. Actually, it made me feel very sad, stressful. So many hormonal imbalance happened that time. Later, for the second time, I got conceived in the year 2025, but unfortunately, it was an MCDA twin pregnancy, and this MCDA twin pregnancies will be having lot of complications, uh, and also it includes my high blood pressure issue also, which occurred in the first pregnancy. And that time we were in very much stress, dilemma, and anxiety. We were thinking like whether to continue this pregnancy or terminate this one. So during that time we have consulted so many doctors, but everyone they told like it will be complicated one only, and no one gave us assurance of having a healthy baby. So that time we met Dr. Disha. So when we met her, she gave us the positivity and confidence of having the healthy baby. So after meeting her, we felt very confident and positivity. So I enrolled for the True Healing pregnancy program journey. So after enrolling to this program, she found out like what are the root causes my body is having. So for all of those, she started functional medications. After taking those, I started feeling very positive, stress free, and also my body was healing like very nicely. So even my high blood pressure remained constant throughout my pregnancy journey, and finally we got we had a healthy baby boy. Recently only had it, and we are very happy about it. Me and my husband are very thankful to Dr. Disha for giving us the healthy baby, for giving us the positivity, and healing us from the root cause. And I highly recommend this True Healing program to anyone who is struggling to get conceived, and also whoever is having pregnancy complications. They should go for this pregnancy journey. It's a very useful one, and I really like to say thanks to Dr. Disha for helping us and made our journey easy to have a healthy baby. Thank you so much.
No postpartum depression. Now this tells us something very important. When pregnancy is managed with root cause medicine, nervous system safety, emotional healing, lifestyle physiology, and respectful medical collaboration, the body responds beautifully. And if you have had losses before, if fear has taken over your pregnancy, please know this. High risk does not mean hopeless. This story is not magic, it is true healing. Physiology restored, fear removed, safety rebuilt. And yes, a healthy pregnancy and postpartum can still be possible for you. I have created a YouTube playlist for you on how to grow a genius baby and how to give a best possible start to your baby. Do check this out. Link in the description below. So ladies, keep learning, keep growing. And until I see you next time, take very good care of yourself. And remember that you have much more power your pregnancy than you were made to believe. May the Divine Mother bless you and guide you in your journey.